I'm Payman Simoni. I'm a dual board certified facial plastic surgeon. I would like to talk about blepharoplasty or plastic surgery for the eyelids. We have two sets of eyelids. We have upper eyelid and we have lower eyelids that can be addressed at the same time or addressed differently. A lot of people ask me, if I want to do one thing to look younger and look better, what would it be? And I always tell them, do your eyes. Because the eyes are the windows to the soul, and by improving and rejuvenating the eye, people automatically look great. That's a procedure that the downtime is very low. It's a quick, easy procedure, and satisfaction is very high.
Hi, my name is Debbie, and I'm having eye surgery today. I'm very, very excited. I want a more youthful look. Really, the thing I'm looking for is every morning when I get up in the morning, I look so tired even if I've gotten my 8 hours of sleep. So I'm really anxious to see the outcome because I know it's going to be wonderful and it's going to be a new me. I'm very excited.
Let's look at the upper eyelid first. Upper eyelid, as we age, the skin becomes looser and we start sagging, and we will lose the show of the upper eyelid with time. As you will look, an aging upper eyelid, you will not see the upper eyelid as much, and the skin could overlie the lashes. Upper eyelid procedure is one of the simplest procedures can be done. It takes about, in my hands, 15 to 20 minutes. I will remove the upper eyelid skin. The incisions are within the crease of the upper eyelid, and the downtime is about 3, 4, sometimes 5 days, depends on the person, and procedure can be done without use of any anesthesia. Let's look at the lower eyelid, which is a little bit more complex. When it comes to the lower eyelid, a lot of people's complaints are the bags underneath the eye. As you will see in this patient, she has bags on both eyes, and there is a little crease underneath the bags, and that creates the little shadow underneath there, and thus creates the baggy eyelid with dark circles underneath there. There's two ways to approach the bags underneath the lower eyelid. One way is the traditional blepharoplasty, which we will perform, and we will make an incision underneath the eyelashes and behind that incision there, and we go in and remove some fat, remove some extra skin, and we close the incision. Just removing the extra skin up here. Is it genetic for you that you get all the, in the family, that the eyelids, or not for you?
It is genetic. We do have start to fall, but more so not our upper lids, is our lower bag, the bags.
That's the extra skin. The other option, which not everybody can qualify, is transconjunctival, or easier to say is no incision or no scar lower eyelid surgery. And the patients could qualify for that procedure. We don't have to make any incision into the lower eyelid, and we go behind the eyelid and remove the fat. Generally speaking, the lower eyelid procedure takes anywhere between half an hour to 45 minutes. And still, I do not use general anesthesia when it comes to lower eyelid procedure. As far as other procedures that can be done to rejuvenate the eye is injections underneath the eyelid, the areas that there is a crease. And some patients that do not require or do not want the lower eyelid procedure, fat or other injectables such as Restylane, Radius, or Jupiter can be placed underneath the eye to give the smoother appearance and a softer look to the eye. let's go back to the upper eyelid. With the upper eyelid, there are times that just removal of the skin is not going to suffice, and some people might need a slight brow elevation if they have a brow ptosis, meaning that the brow is lower than it should be, and we can perform this through the endoscopic approach or through temporal approach without making any visible incisions, and all these incisions are small and hidden within the hairline, and we can lift up the eyebrow in that sense. I prefer doing the eyelid procedures without anesthesia. The reason is that a lot of times we make guesses as the person is under anesthesia and they're lying flat, and we will make a guess how much skin to remove. But what I like to do is that to take that guesswork out. There are times that those guessworks cause retraction of the lower eyelid, meaning that some people take a little bit more skin than is necessary, and the eyelid looks to be inverted and is pulling down and create a rounder look to the eye. What I like to do is, during the procedure, I like to put the patient in a slight sitting position, and during the procedure I ask the person to move their eyes and open their mouth and exactly know how much skin to remove, and decrease the guesswork and decrease the risk of removing any extra skin that is really needed, and gives more natural result. The downtime is almost in half when we don't use anesthesia, because the amount of bruising and swelling seems to be less without using an anesthesia. When it comes to upper eyelid or lower eyelid procedures, patients can go out putting a shaded glass within the few days, because there are some slight bruising on the upper or lower eyelid or both after the procedure, which is minimized by removing anesthesia, but the person can just wear eyeglass and they can walk out without anybody knowing they have any procedures done.